If you've been somewhere in the past and you felt like you haven't gotten any help, you're wondering, what could we do different? How could we do anything different? We're really going to take a look at, like I said, your first visit is what have you done in the past, what has worked for you, and what has not worked for you. We're going to look at what they did. We're going to look for things that possibly may have been missed. Some people do tests out of order. That could be a huge part. We are going to look at what you did. We will tell you if we think they were on the right track and you need to continue this route, or no, we want to go a completely different direction. We will be very open and honest with you about it. There are a couple things about functional medicine that's really interesting. Functional medicine, one, is really broad. So you may have somebody that took a couple courses in functional medicine and they just dabble in it. I always like to tell patients, if you're going to, when they call, they have their discovery call here and they're asking questions and they want to still call around, make sure you ask them, are they doing it full time? Because a functional medicine practitioner that does another specialty and they just, whatever patient, if this patient needs functional medicine, then we'll do functional medicine with you, is very different than a functional medicine that does it day in and day out. Every single day, we get so many unique patients that have been to 10 different doctors that don't know what's wrong with them. We see these weird cases that nothing else ever helps. When you have your practitioner always seeing these unique things, they're going to be able to work with you better because they're going to be able to find those little things and they know what to look for. Another thing is when you go to your functional medicine training and you get certified, they don't tell you a way to practice. They tell you these things that help and they teach you all about functional medicine. So every practitioner is going to do their own method, basically. And we really stand by our method, that step-by-step approach, not doing everything at once, not overwhelming the body. Functional medicine is well known that it does take time, that we can't rush it. Over the years, Dr. Craig has been doing it so long, he saw what worked in the beginning and what didn't. And that's how he came up with this method that he does. So that might be a way that we might be a little bit different, but when you are doing that discovery call for all the different places, ask questions. Ask how, if they do functional medicine full time, how many tests do they do at once? What do they do at the first visit? What do they do at the second visit? Things like that are very, very important.